All those pregnant moms that the moment you just see 2 lines on your pregnancy test like this, the next thing is it's for 2. Honey, buy me shawarma, buy me ice cream, buy me suya. Only use eating the food meant for 10 people because you say you're feeding your baby that knows nothing about the food you are eating. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. Oh yeah. I'm sure you can tell that I'm pretty much excited today. I'm always excited to see you guys. So I got a message from one of our Ozone members, and in her message she was saying that she's pregnant. Okay, super excited for that. We're always excited anytime any one of our Ozone community members gets pregnant because it's such a big deal, and that's what this show is all about. So yay for you, Miss K. So happy for you and can't wait to meet your little one. Anyway, so the real issue here is not the pregnancy. She's super happy about that. The problem is that she has a family dinner that she has to go for, and it's one of those family dinners where you cannot be MIA. You must be present. Okay, you must mark attendance there, and she's in her first trimester, and you guys know what comes with first trimester. If you've ever been pregnant before, veteran moms, you can bear me witness. Morning sickness. Okay, this is what we call nausea and vomiting in pregnancy in the medical world, but everyone knows this as morning sickness. And you know that literally every pregnant woman, or almost every pregnant woman, has had to deal with morning sickness. And because of this, pregnancy, especially in your first trimester, can be such a drag, having to deal with food coming out the wrong way every time, because food is meant to go down, but instead of going down, it's coming up. That can be so annoying. So Miss K wants to know, how is she going to survive this family dinner without actually revealing her big secrets? Because right now she's not told her family members that she's pregnant, just because she wants to keep it a secret, which is totally fine, because a lot of people don't feel comfortable revealing their pregnancy until later stages, probably the second or the third trimester. Totally nothing wrong with that. So she wants to keep her little secret a secret. But if she throws up at the dinner table, some of our moms are going to suspect that there's something wrong. Tell me what's going on here. All those people that can just look at you and tell you that you're pregnant even without you saying a word, right? Like you look really, really normal, and they just go like, you're pregnant, can't do pregnancy test. Those are the real veteran moms. Okay, so back to what we were saying, right? So she needs to go for this family dinner. She's in her first trimester. She's dealing with morning sickness, and she doesn't know what to do to keep her secret. Today, Miss K, this episode is inspired by you. I'm going to be sharing with you, my Ozone moms, how to deal with morning sickness, and I'll be giving you very, very useful tips. So stay tuned. Welcome back. My number one tip, useful way to deal with morning sickness. Now, this tip might sound very simple, like straightforward, and you can be like, really? Is that it? Well, that's it. But trust me, it works. Avoid any food that contains oil or fat. So basically, avoid oily or fatty food. And this is very important, you see, because foods that have oil, talking about fried foods, plantain, that delicious fried plantain, fried rice, fried eggs, anything that generally has oil in it, they tend to make you feel more nauseous. So you are more likely than not to throw up when you eat something that has a lot of oil in it. So you might want to avoid anything that has oil. Go for foods that are boiled, things that have very little oil, if possible no oil at all in them, right? You're less likely to throw up when you go for foods like that. So think about it and adjust your diet in your first trimester. Number 2 way you can deal with morning sickness. You see all those pregnant moms that the moment you just see 2 lines on your pregnancy test like this, the next thing is it's for 2. Honey, buy me shawarma, buy me ice cream, buy me suya. Only use eating the food meant for 10 people because you say you're feeding your baby that knows nothing about the food you are eating. You say you're feeding 2 people, so therefore you must eat everything. Let me just let you know that that's not gonna work in your first trimester. If you want to eat, especially if you are dealing with morning sickness, you might want to cut down your portions of food. So my number 2 tip for you is eat smaller portions but at regular intervals. So you're not just going to take a whole bowl of food and just sit down, only you finish everything, gulp everything down your mouth. Because what's going to happen? Next couple of minutes, all that food is going to come back up. So you pretty much just wasted your time eating. Like sometimes when you are pregnant and you throw up, don't you feel like you just wasted your time eating? Like that can be so annoying. Let me know if that has happened to you before. If you felt like eating is just a waste of time, trust me, I can totally relate. Anyway, as I was saying, make sure you eat food in small portions but regular portions. That way the food stays down. So this is the thing. You don't want your tummy to be too full and then you throw up. At the same time, you don't want your tummy to be totally empty, because even when your tummy is totally empty, you tend to feel more nauseous. So you want to sort of strike a balance where we are in between. Your tummy is not too full, it's not too empty. You just have the right balance, right? So that at least you keep something down and then baby sees something to eat, right? Number 3 tip. This might seem, again, very simple and it might seem like common sense, but trust me, some moms don't know this. And you know, this show is both for new moms, veteran moms. So veteran moms, no judging here, okay? When you have morning sickness, of course, you might have experienced it that there's some smells that begin to irritate you. It might even be your favorite food that you used to love. Maybe you used to love that suya. Now when you smell suya, you're just like, oh. Or maybe your favorite perfume. You used to love it so much, but all of a sudden when you speak, you're just like, what on earth is that smell? And your husband will be like, isn't that your favorite perfume? And you're like, no, that can't be my favorite perfume, you know? Has it happened to you where pregnancy makes you hate something you used to love? Like your favorite food suddenly becomes your worst food ever and you never want to see it again, right? Let me know if that has also happened to you. My number 3 tip, avoid any smells that make you feel nauseous. So for example, if it's a perfume that you used to like and all of a sudden when you spray it, you just want to throw up, just do away with that perfume. Like give it out, do give away, right? Because you don't want anything that is making you feel nauseous. If it's your partner's perfume, beg your partner that please, baby wants you to stop using the perfume. It's not you that wants them to stop using it. It's the baby that wants them to stop using. Let them know, right? And if it is food, you know, has this happened to you again when you are pregnant that you just couldn't cook throughout your first trimester because just the smell of food, you just want to throw up? Yeah. And then some of you are going to use that as an excuse not to cook again. But oh well, that's some of the perks of being pregnant, right? You can use your pregnancy as an excuse for anything. I didn't say that. Okay, so yeah, if it is food, that the smell of food, and it's not all food, a lot of times it's certain foods, right? Then you might want to stay away from the kitchen, right? Or avoid those foods that make you feel nauseous. So for my dear friend that is going for dinner, right? Stay far away from the food stand. Don't sit anywhere close to the kitchen. And if people around you are eating and their food is making you feel nauseous, just excuse yourself gently from the table. Pretend like you don't take a phone call. Just bring your phone and be saying, hello, excuse me, I need to take a phone call right now. Just give me a few minutes. And then you go out and receive some fresh air, okay? And if for any reason when you left the room, you know, there's sometimes that you want to throw up and you feel like, okay, I got this, I'm holding this, you know, throwing up back, and then somehow the thing is like, no way, and then the thing wants to come out, just gently rush to the toilet and throw up. Most times after you throw up, you feel better. But this bonus tip, anytime you throw up, do not forget to rinse your mouth. If you're at home, it's good, you can brush your teeth or use mouthwash. But if you're outside, like at a restaurant, someone else's house, and you don't have access to mouthwash, water is everywhere, right? Just take water and rinse your mouth. Now, why did I say this? You know that your stomach contains acid, which helps to digest the food. Now, when you throw up, guess what's going to come out along with the food? Not just the food that you ate, but also some of that acid would actually come back into your mouth. Now, the bad part of this is that acid is actually harmful for your teeth, right? It starts to destroy the outer layer of your teeth, which we call the enamel. And trust me, you want your teeth to be looking good for that maternity shoot, right? So make sure that if you do throw up, when you do throw up, always rinse your mouth. And if you have access to like toothbrush or whatever, good to brush your teeth, even better. Which brings me to my next tip. Whenever you are dealing with morning sickness, do not brush your teeth immediately after eating, okay? Do not try this. Because I'm sure veteran moms can bear me witness. Can someone tell me what's going to happen if you brush your teeth? Yeah, you guessed right. All that food you get is going to come all the way back up, and you're going to throw up. Exactly what we don't want. Now, let me explain why this happens. When you are pregnant, your body releases some hormones, okay? And these hormones tend to relax some muscles in the body, including the muscles of the digestive tract. Now, when you brush your teeth, when you're brushing your teeth is okay. But the moment you take that toothbrush and touch the back of your tongue, it's going to induce the gag reflex, and all the food is going to come rushing out. And you don't want that to happen, because it's such a horrible feeling. Like, every pregnant woman can bear me witness that food coming up the wrong way is not the best thing, right? You don't want to experience it. So if you're a new mom, take this advice now. Do not brush immediately after eating. Now, this is not only immediately after eating, even when you've not eaten. The moment that toothbrush touches the back of that tongue, you are going to throw up. It is guaranteed. So when you are brushing, you want to be careful. When you are cleaning your tongue, because we did not say that because you are pregnant, you should not clean your tongue. Then you will not clean your tongue, and then people beside you will now start to suffer. Nothing like that. But clean your tongue, but do this gently. So when you are brushing, you just be rushing, just brushing everything. No, take your time. If possible, tiptoe to the back of the tongue and just brush it gently. But the moment you go too far back or press it too hard, you are going to throw up. Don't say I didn't warn you. So make sure you are careful anytime you are brushing, and do not brush immediately after eating, because that's just going to be a total disaster. My next tip is very important. When you get pregnant, we tend to take a lot of prenatal vitamins, to supplement the ones we actually get from the food. Some pregnant women don't even wait for doctors to prescribe. Once they are pregnant like this, they are rushing to the pharmacy to go and buy vitamins. So there's absolutely nothing wrong with this. But if you notice that you are having frequent morning sickness and you are taking prenatal vitamins, you might want to check the content of that prenatal vitamin that you're taking. Prenatal vitamins that have high iron content, iron is a mineral by the way, when they have high iron content, they tend to make you feel more nauseous than those that have little or no iron content. And this might be ironic, because when you are pregnant, especially in your first trimester, you actually need more iron. That's the time you need iron the most, and prenatal vitamins containing iron make this nausea worse. So what you want to do is discuss with your doctor, strike a balance. Let them prescribe prenatal vitamins that have less iron content or no iron content, and if you must do away with the iron, then supplement with foods that are rich in iron. So green leafy vegetables, they are very rich in iron. They can serve as a good supplement in your diet for that iron. And then once the morning sickness phase is over, you can then continue to take your iron supplements. On the contrary, vitamin B6, which is a vitamin, as you already know, actually suppresses the feeling of nausea. So prenatal vitamins that are high in vitamin B6 content tend to help with dealing with morning sickness, because they tend to suppress the nausea you are feeling. So you might want to tell your doctor to prescribe prenatal vitamins that have more vitamin B6 content, or prescribe the vitamin B6 alone in addition to whatever you are taking. This will help you to deal with that nausea that you are always experiencing. And my final tip for dealing with nausea, have you heard of this thing called peppermint? All those peppermint sweets, sugar-free peppermint chewing gum. Trust me, you should have that in your purse everywhere you go. Literally do not leave your house without it, because that thing is a lifesaver. Anytime you go out and you're in a public place and for whatever reason you feel like you are about to throw up, try popping one into your mouth, lick it, chew it, whatever you need to do to it, right? It will help to actually suppress that feeling of nausea. It really works. So for my ozone community member that is going for dinner, try chewing peppermint sweets and see how it works out for you. Okay, so these are all the tips I have for you today. These are ways that you can deal with morning sickness. Let me know, which of these tips have you tried? Which of these tips have actually worked for you? Are there any tips that you've tried that I've not mentioned? Let's know in the comment section down below. We really love to hear from you. If you're just joining or you're just watching for the first time and you enjoyed this video so far, don't forget to click the like button, subscribe and share with someone you think needs to see this, okay? And like I always say, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.